Heather Fegan is in the prime of her life, newly married to the man of her dreams and in a career that she loves. You'd never guess that from the age of 14 up until about a year ago, Heather endured consistent periods of pain because of flare-ups caused by Crohn's disease.
When I first got sick, I think I lost 20 pounds in a month, and I was really skinny and really weak, and I'm sure people wondered, oh, does she have an eating disorder? After that first month of really being sick, I landed in the hospital, and I was there for a month. I went through every drug in the book, and I would either be allergic or they would make me sicker, and just nothing really worked.
Depression, missing out on social activities, absence from work or school, surgery, and hospitalizations are all realities for someone living with this disease. And while it can occur at any age, most people are diagnosed between the ages of 15 and 35. Dr. Des Ledden specializes in the treatment of Crohn's disease.
The spectrum of Crohn's disease varies from people who might have one attack and never have another one. To the other end of the spectrum would be people who get an attack of Crohn's and it never stops. The majority of people live well with Crohn's, but a significant minority, life can be pretty difficult.
While there's no cure, Crohn's disease is manageable. With advances in research, there are now effective treatments that can sustain remission, allowing patients to return to a normal quality of life. Heather says her turning point came when she needed to travel for a job interview. At the same time, she was experiencing a major flare-up.
I knew I had to go because I was not going to let Crohn's stop me from getting my dream jobs. It worked out in the end because I ended up getting the job, and from there, that's when I started a new treatment. I decided to try Humira, a new treatment, and instantly I started feeling better, and my Crohn's has become a lot more manageable.
And it appears that these drugs, by blocking tumor necrosis factor, can make the disease go away. And for the first time with any of these drugs, really, we can actually see the disease heal up inside the bowel and essentially disappear. These anti-TNF antibodies are very effective in settling down the disease. Not everyone needs them. They're very powerful, and they do have risks of infection or tumor growth, which fortunately is very rare. But they are extremely effective.
People can live well with Crohn's disease. If you have been diagnosed with Crohn's disease and you're not feeling your best, if you're having unresolved gastrointestinal symptoms, or you want more information about Crohn's disease, speak with your doctor. Sherry Dematarco reporting.